Welcome to the podcast series The New Student Pharmacist, where we discuss chemistry and pharmacy, as well as leaders in pharmacy careers, community, and chemistry and pharmacy research. We encourage you to support the work we are doing and follow us on Spotify and Apple Podcasts by subscribing for free. Note, the views on the podcast represent those of my guest and I.
Purpose of these episodes not at all for advice or medical suggestions. These are aimed to provide support to peer pharmacists in training in educational and intellectually stimulating ways. Again, these are not at all for medical advice or medical suggestions. Please see your local board and state-certified health professional. The views of this podcast represent those of my guests and I.
You are very important, especially to us here at the New Chemist podcasting group. You listening in is significant.
Vous êtes très important, surtout pour nous ici au New Chemist Podcasting Group. Votre écoute est significative.
Usted es muy importante, especialmente para nosotros aquí en The New Chemist Podcasting Group. Usted escuchando, es significativo.
Você é muito importante. Especialmente para nós do The New Chemist Podcasting Group. Você ouvindo, é significativo.
Είστε πολύ σημαντικοί, ειδικά για εμάς εδώ στο The New Chemist Podcasting Group. Το να ακούς είναι σημαντικό.
Sie sind sehr wichtig, besonders für uns hier bei The New Chemist Podcasting Group. Es ist wichtig, dass du zuhörst.
Je bent erg belangrijk, vooral voor ons hier bij The New Chemist Podcasting Group. Dat je meeluistert, is veelbetekenend.
You are very important, especially to us here at the New Chemist podcasting group. You listening in is significant.
In the heart of the cell where secrets dwell, lies the nucleus, a masterful genesis, chromatin networks dancing in twists and swirls, holding the codes, the stories untold. O nucleus in your chromosomal embrace, regulating life with elegance and grace. Gene expression, in your controlled procession, you weave the fabric of our very essence. With histones and nucleosomes, a tightly wound script, epigenetic mysteries in a chromatic crypt. Transcription factors binding, with a rhythmic swing, promoters and enhancers make the cellular world sing. O nucleus, a dynamic domain so crucial, in cancer's shadow your balance becomes crucial. Gene silencing and activation in a delicate dance, in the story of life you lead the advance. Splicing and dicing RNA information, mRNA travels with vital information. From the depths of the nucleus to the cytoplasmic seas, a journey of codes unlocking life's mysteries. In the nucleus where genetic fates intertwine, mutations whisper, the onset of a malignant sign. Oncogenes and suppressors in a delicate play, when the balance tips the cellular order sways. O nucleus, in your realm so profound, life and death in your cycles are bound. In the dance of genes, under the bossa nova sky, you hold the key where the answers lie. In the swing of life, in the rhythm of existence, the nucleus endures with resilient persistence. In the bossa nova beat, hear the cellular song, in the heart of the cell where the truths belong.
First, note, the views of this podcast represent those of my guest, S, and I note, purpose of these episodes not at all, for advice or medical suggestions. These are aimed to provide support for peer pharmacists in training in educational and intellectually stimulating ways. Again, these are not at all for medical advice, or for medical suggestions. Please see your local state and board certified physician, PA or NP, and pharmacist for medical advice and suggestions. Alright class, let's embark on a journey through the world of anti-anginal drugs. Today, we're going to explore the mechanisms, classifications, and key points about these medications. 1. The 4 kinds of anti-anginal drugs. Beta blockers, calcium channel blockers, nitrates, ranolazine. Now, let's engage in some active recall. Can anyone name one of the 4 kinds of anti-anginal drugs we just discussed? Student response, that's right. Beta blockers are one of them. 2. First-line treatment for stable ischemic heart disease, SIHD. What's the first-line treatment for SIHD? Student response, exactly, beta blockers take the lead here. 3. Preferred drug for Prinzmetal's angina. How about Prinzmetal's angina? What's the preferred drug for treating it? Student response, spot on. Calcium channel blockers are preferred for Prinzmetal's angina. 4. What to avoid with calcium channel blockers for Prinzmetal's angina. What should you avoid when taking calcium channel blockers for Prinzmetal's angina? Student response, yes, avoiding nifedipine IR is crucial in this case. 5. Adding a beta blocker to the treatment for Prinzmetal's angina. If you're adding a beta blocker to the treatment for Prinzmetal's angina, what type of drug should you use? Student response, absolutely, using a dihydropyridine calcium channel blocker, CCB, is recommended. 6. Unique mechanism of ranolazine. Now, let's talk about ranolazine. How does it differ from other anti-anginal drugs in terms of its mechanism of action? Student response, correct. Ranolazine does not decrease heart rate or blood pressure. Now, let's switch gears and discuss some key points about nitrates. 7. Fast relief and chronic symptoms. Which drug do you use for fast relief and for chronic nitrate symptoms? Student response, that's right. Nitroglycerin is the go-to for both fast relief and chronic symptoms. 8. Drug interaction with ranolazine. Which enzyme does ranolazine have a drug interaction with? Student response, yes, it interacts with CYP3A4. 9. Short-acting nitrates. Can anyone name one of the short-acting drugs belonging to the classification of nitrates? Student response, great. Glyceryl trinitrate is one of them. 10. Intermediate-acting nitrate. How about an intermediate-acting drug from the nitrate classification? Student response, correct. Isosorbide dinitrate, ISDN, is an example. 11. Longest-acting nitrate. What about the longest-acting drug from the classification of nitrates? Student response, spot on. Penteritridal tetranitrate is one of them. Now, let's delve into calcium channel blockers. 12. Dihydropyridines versus miscellaneous. Which calcium channel blocking drugs belong to the drug class of dihydropyridines? Student response, exactly. Amlodipine, felodipine, isradipine, nicardipine, nifedipine, and nisoldipine are all in this class. 13 miscellaneous calcium channel blockers, and which ones belong to the drug class of miscellaneous? Student response, well done. Diltiazem and verapamil are the ones. Now, before we wrap up, let's quickly review one more category. 14 beta blockers. Can anyone name one of the beta blockers we discussed earlier? Student response, correct. Acebutolol is one of them. In conclusion, understanding the mechanisms and classifications of anti-anginal drugs is crucial for managing various cardiovascular conditions. Remember, each drug has its unique role and considerations in treatment. Keep studying, and I'll see you all next time. Continuing on. Yo, it's time to drop knowledge, so listen up, folks. I'm spitting out facts, no need for lame jokes. We talk in polyethylene glycol, it's the real deal. Go lightly, Nolitelli, Moviprep, Plenvua, they make you feel. Prep for colonoscopies, keeping your gut clean, or dealing with constipation, it's the remedy scene. But wait, let's switch gears. Talk and potassium chloride, Clercon in the house, keeping potassium on our side. Go lightly, Nolitelli, Moviprep, Plenvua, polyethylene glycol, that's the move. Clercon keeping us right, in the groove. Brand names poppin', generics droppin', in the world of drugs, ain't no stoppin'. Potassium iodide, SSKI, IOSAT, Thyrosafe, radiation exposure, we gotta be safe. But it's not just that, it's an expectorant too, clearing out the chest, that's what it'll do. Pramipixole, known as Mirapex, keeping us steady, Parkinson's and restless legs, keeping us ready. Ifiant, Persegral, previous ending clots with ease, after coronary intervention, we're pleased. Go lightly, Nolitelli, Moviprep, Plenvua, polyethylene glycol, that's the move. Clercon keeping us right, in the groove. Brand names poppin', generics droppin', in the world of drugs, ain't no stoppin'. Pravastatin, Pravachol, keeping cholesterol in line, previous end-in strokes and heart attacks, that's the sign. Orapred, Pediapred, tackling allergies and more, from asthma to GI issues, it's what we adore. Prednisone, Deltasone, for a myriad of woes, from allergies to rheumatoid, the relief it bestows. Lyrica, Pregabalin, for nerve pain supreme, from diabetes to seizures, it's like a dream. Go lightly, Nolitelli, Moviprep, Plenvua, polyethylene glycol, that's the move. Clercon keeping us right, in the groove. Brand names poppin', generics droppin', in the world of drugs, ain't no stoppin'. So there you have it, the lowdown on the scene, brand names, and generics, keeping us clean. From colonoscopies to nerve pain relief, in the world of medicine, we find our belief. Again yo, listen up, let me lay it down, gonna break it up, gonna spread it around. Polyethylene glycol, let's start the show. Go lightly, Nolitelli, Moviprep, Plenvua, let's go. For colonoscopy prep, they got the fame, clearing out your gut, ain't that a game? Potassium chloride, Clercon in the mix, hypokalemia's no joke, gotta fix. Go lightly, Nolitelli, Moviprep, Plenvua, Clercon, SSKI, IOSAT, Thyrosafe 2. Brand names flying, generics multiplying, in the world of meds, we're never denying. Pramipixole, Mirapex, shaking off Parkinson's strain, restless legs, no more, it's the refrain. Ifiant, Persegral, preventing clots so mean, after heart procedures, keeping things clean. Pravastatin, Pravachol, battling cholesterol's fight, protecting your heart, keeping it tight. Orapred, Pediapred, Prednisolone Sway, Asthma, Dermatitis, it's saving the day. Go Lightly, Nulli-Telli, Moviprep, Plenvua, Clercon, SSKI, IOSAT, Thyrosave 2. Brand names flying, generics multiplying, in the world of meds, we're never denying. Lyrica, Pregabalin, calming neuropathic storm, fibromyalgia, seizures, keeping you warm. Precare, Prenexa, prenatal care in the fold, healthy moms, healthy babes, stories untold. Compazine, Prochlorperazine, nauseous dread, Prometrium, progesterone, keeping cycles fed. Inderal, Propranolol, calming heart spree, migraines, hypertension, setting you free. Go Lightly, Nulli-Telli, Moviprep, Plenvua, Clercon, SSKI, IOSAT, Thyrosave 2. Brand names flying, generics multiplying, in the world of meds, we're never denying. Seroquel, Seroquel XR, Quishapines claim, bipolar, schizophrenia, it's in the game. Acupril, Quinapril, hearts they embrace, hypertension's foe, in every case. So here's the lowdown, the world of drugs in a spin, brand names, generics, let the healing begin. From Parkinson's to pregnancy, they got the score, in the realm of pharmaceuticals, we all endure. 1. What is the brand name of polyethylene glycol, Go Lightly, Nulli-Telli, Moviprep and Plenvua 2? What is the generic name of Go Lightly, Nulli-Telli, Moviprep and Plenvua, polyethylene glycol 3? What is / are the indications of polyethylene glycol, Go Lightly, Nulli-Telli, Moviprep and Plenvua? 1. Colonoscopy or barium enema preparation. 2. Constipation. 4. What is the brand name of potassium chloride, Clercon 5? What is the generic name of Clercon, potassium chloride? 6. What is / are the indications of potassium chloride, Clercon? 1. Hypokalemia. 2. Hypokalemia, prophylaxis. 7. What is the brand name of potassium iodide, SSKI, IOSAT, and Thyrosave 8? What is the generic name of SSKI, IOSAT, and Thyrosave, potassium iodide? 9. What is / are the indications of potassium iodide, SSKI, IOSAT, and Thyrosave? 1. Prevention of thyroid dysfunction due to radiation exposure. 2. Expectorant. 10. What is the brand name of Pramipexole, Mirapex and Mirapex ER? 11. What is the generic name of Mirapex and Mirapex ER? Pramipexole. 12. What is / are the indications of Pramipexole, Mirapex and Mirapex ER? 1. Parkinson disease. 2. Restless leg syndrome. 13. What is the brand name of Prasugrel, Ifiant? 14. What is the generic name of Ifiant, Prasugrel? 15. What is / are the indications of Prasugrel, Ifiant? 1. Prevention of thromboembolism after percutaneous coronary intervention. 16. What is the brand name of Pravastatin, Pravachol? 17. What is the generic name of Pravachol, Pravastatin? 18. What is / are the indications of Pravastatin, Pravachol? 1. Cerebrovascular accident, prevention, coronary arteriosclerosis, primary or secondary prevention. 2. Familial hypercholesterolemia. 3. Hyperlipidemia. 19. What is the brand name of prednisolone oral, Orapred and Pediapred? 20. What is the generic name of Orapred and Pediapred, prednisolone oral? 21. What is / are the indications of prednisolone oral, Orapred and Pediapred? 1. Allergic states, e.g., asthma, etc. 2. Dermatologic diseases, e.g., exfoliative erythroderma, etc. 3. Endocrine disorders, e.g., adrenocortical insufficiency, etc. 4. GI diseases, e.g., regional enteritis, ulcerative colitis, etc. 5. Hematologic disorders, e.g., acquired hemolytic anemia, etc. 6. neoplastic diseases, e.g., palliative management of leukemias and lymphomas, etc. 7. Nervous system, e.g., multiple sclerosis, cerebral edema, etc. 8. Renal diseases, e.g., idiopathic nephrotic syndrome, systemic lupus erythematosus, etc. 9. Respiratory diseases, e.g., idiopathic eosinophilic pneumonia, etc. 10. Rheumatic disorders, e.g., rheumatoid arthritis, etc. 22. What is the brand name of prednisone? Deltasone 23. What is the generic name of deltasone? Prednisone 24. What is / are the indications of prednisone? Deltasone. 1. Allergic states, e.g., asthma, etc. 2. Dermatologic diseases, e.g., exfoliative erythroderma, etc. 3. Endocrine disorders, e.g., adrenocortical insufficiency, etc. 4. GI diseases, e.g., regional enteritis, ulcerative colitis, etc. 5. Hematologic disorders, e.g., acquired hemolytic anemia, etc. 6. Neoplastic diseases, e.g., palliative management of leukemias and lymphomas, etc. 7. Nervous system, e.g., multiple sclerosis, cerebral edema, etc. 8. Renal diseases, e.g., idiopathic nephrotic syndrome, systemic lupus erythematosus, etc. 9. Respiratory diseases, e.g., idiopathic eosinophilic pneumonia, etc. 10. Rheumatic disorders, e.g., rheumatoid arthritis, etc. 25. What is the brand name of pregabalin? Lyrica 26. What is the generic name of Lyrica? Pregabalin 27. What is / are the indications of pregabalin? Lyrica. 1. Neuropathic pain, diabetes associated or spinal cord injury associated. 2. Fibromyalgia. 3. Seizures, focal, partial, onset, adjunct. 4. Postherpetic neuralgia. 28. What is the brand name of prenatal vitamin? Precare and Prenexa. 29. What is the generic name of Precare and Prenexa? Prenatal vitamin. 30. What is / are the indications of prenatal vitamin? Precare and Prenexa. 1. Dietary supplementation during pregnancy. 31. What is the brand name of prochlorperazine? Compazine. 32. What is the generic name of compazine? Prochlorperazine. 33. What is / are the indications of prochlorperazine? Compazine. 1. Nausea and vomiting. 34. What is the brand name of progesterone? Prometrium. 35. What is the generic name of prometrium? Progesterone. 36. What is / are the indications of progesterone? Prometrium. 1. Prevention of estrogen-induced endometrial hyperplasia. 2. Secondary physiologic amenorrhea. 3. Assisted reproduction for infertile women. 37. What is the brand name of promethazine? Phenergan. 38. What is the generic name of Phenergan? Promethazine. 39. What is / are the indications of promethazine? Phenergan. 1. Nausea and vomiting. 40. What is the brand name of propranolol? Inderal, Inderal LA, and Inderal XL. 41. What is the generic name of Inderal, Inderal LA, and Inderal XL? Propranolol. 42. What is / are the indications of propranolol? Inderal, Inderal LA, and Inderal XL? 1. Angina pectoris, chronic. 2. Cardiac dysrhythmia. 3. HTN. 4. Migraine, prophylaxis. 43. What is the brand name of quishapine? Seroquel and Seroquel XR. 44. What is the generic name of Seroquel and Seroquel XR? Quishapine. 45. What is / are the indications of quishapine? Seroquel and Seroquel XR. 1. Bipolar disorder or schizophrenia, therapy initiation. 2. Bipolar disorder or schizophrenia, maintenance. 3. Major depressive disorder, adjunct to antidepressants. 46. What is the brand name of Quinapril? Acupril. 47. What is the generic name of Acupril? Quinapril 48. What is slash are the indications of quinapril? Acupril 1. Heart failure 2. HTN 49. What is the brand name of rabeprazole? Ace-of-Hex 50. What is the generic name of Ace-of-Hex? Rabeprazole 51. What is slash are the indications of rabeprazole? Ace-of-Hex 1. Peptic ulcer disease 2. H. pylori GI infection 3. Gastric hypersecretion 4. GERD, erosive or ulcerative, for symptom control, initial treatment, or maintenance 52. What is the brand name of raloxifene? Evista 53. What is the generic name of Evista? Raloxifene 54. What is slash are the indications of raloxifene? Evista 1. Breast cancer, invasive, in postmenopausal women at high risk 2. Postmenopausal osteoporosis, prevention, or treatment 55. What is the brand name of raltegravir? Isentress 56. What is the generic name of Isentress? Raltegravir 57. What is slash are the indications of raltegravir? Isentress 1. Treatment of HIV-1 infection in combination with other antiretroviral agents 58. What is the brand name on Ramipril? Altase 59. What is the generic name of Altase? Ramipril 60. What is slash are the indications of Ramipril? Altase 1. Heart failure post-MI2, HTN 3, reduce risk of myocardial infarction, stroke, and death from cardiovascular causes 61. What is the brand name of ranolazine? Ranexa 62. What is the generic name of Ranexa? Ranolazine 63. What is slash are the indications of ranolazine? Ranexa 1. Chronic angina 64. What is the brand name of repaglinide? Prandin 65. What is the generic name of Prandin? Repaglinide 66. What is slash are the indications of repaglinide? Prandin 1. Diabetes mellitus type 267. What is the brand name of rifaximin? Xifaxan 68. What is the generic name of Xifaxan? Rifaximin 69. What is slash are the indications of rifaximin? Xifaxan 1. Hepatic encephalopathy, prevention 2. Irritable bowel syndrome without constipation 3. Traveler's diarrhea 70. What is the brand name of risdronate? Actinol and Adelvia 71. What is the generic name of Actinol and Adelvia? Risdronate 72. What is slash are the indications of risdronate, Actinol and Adelvia? 1. Osteoporosis, males, and postmenopausal women, prevention and treatment 2. Paget disease 73. What is the brand name of risperidone? Risperdal 74. What is the generic name of Risperdal? Risperidone 75. What is slash are the indications of risperidone? Risperdal 1. Autistic disorder, irritability 2. Acute manic or mixed episodes of bipolar I disorder 3. Schizophrenia 76. What is the brand name of rivaroxaban? Xarelto 77. What is the generic name of Xarelto? Rivaroxaban 78. What is slash are the indications of rivaroxaban? Xarelto 1. Prevention of thromboembolism in patients after orthopedic surgery 2. Prevention of thromboembolism in patients with non-valvular atrial fibrillation 3. Treatment and secondary prevention of DVT or pulmonary embolism 4. Coronary artery disease, stable, or peripheral artery disease 79. What is the brand name of rizatriptan? Maxalt 80. What is the generic name of Maxalt? Rizatriptan 81. What is slash are the indications of rizatriptan? Maxalt 1. Migraine 82. What is the brand name of Ropinrol? Requip and Requip XL 83. What is the generic name of Requip and Requip XL? Ropinrol 84. What is slash are the indications of Ropinrol? Requip and Requip XL 1. Parkinson disease 2. Restless leg syndrome 85. What is the brand name of rosuvastatin? Crestor and Izalar 86. What is the generic name of Crestor and Izalar? Rosuvastatin 87. What is / are the indications of rosuvastatin, Crestor and Izalar? 1. Hyperlipidemia, prevention of cardiovascular disease. 2. Familial hypercholesterolemia. 88. What is the brand name of rotavirus vaccine? Rotarix and Rotatec. 89. What is the generic name of Rotarix and Rotatec, rotavirus vaccine? 90. What is / are the indications of rotavirus vaccine, Rotarix and Rotatec? 1. Prophylaxis of viral gastroenteritis due to rotavirus infection. Continuing on. Let's dive into angina, a heart's rocky road, with drugs as our guide. Let's crack the code. Beta blockers stand tall, reigning supreme, while calcium channels, nitrates, join the team. First line for SIHD. Beta blockers, the crown jewel, Prinzmetal's angina. Calcium blockers rule. But beware nifedipine IR, it's a tricky site. For Prinzmetals, it might not treat you right. Nitrostat for quick relief, in times of strife, with CYP3A4, ranolazine dances in life. Amyl nitrite, ISDN, ISMN take the stage, nitrates in varieties, from short to long gauge. Short acting, intermediate, long acting too, nitrates come in flavors, for whatever you're going through. Dihydropyridines like amlodipine in the mix, and don't forget verapamil, with its bag of tricks. From Coreg to Norvasc, nitrostat in hand, Sular, Cardine, they cover the land. Atenolol, bisoprolol, propranolol, they stand strong, in the rhythm of anti-anginals, they belong. Stendra, Viagra, Chalice, Levitra on the side, for those moments of passion, they take us for a ride. But in the realm of angina, where hearts hold sway, these drugs keep the beat, come what may. So here's the rap, with brands, and generics to know, in the symphony of the heart, they set the flow. From amlodipine to propranolol, they play their part, in the world of anti-anginals, they're the heart's art. Anti-anginal drugs lecture, alright, class, today we're going to dive into the world of anti-anginal drugs. Now, before we begin, I want you to recall the 4 main types of drugs used for anti-anginal treatment. Can anyone name them? Call and respond, class, beta blockers. Instructor, that's right. Beta blockers are one of them. What else? Class, calcium channel blockers. Instructor, good job. What's next? Class, nitrates. Instructor, excellent. And the last one? Class, ranolazine. Instructor, perfect. Now that we've got that down, let's move on. Now, let's talk about the first line treatment for stable ischemic heart disease, SIHD. Can anyone tell me what it is? Call and respond, class, beta blockers. Instructor, absolutely correct. Beta blockers are indeed the first line treatment for SIHD. Moving on to Prinzmetal's angina, what's the preferred drug for this condition? Call and respond, class, calcium channel blockers. Instructor, that's right. Calcium channel blockers are preferred for Prinzmetal's angina. Now, when taking calcium channel blockers for Prinzmetal's angina, what's one thing we should avoid? Call and respond, class, nifedipine IR. Instructor, spot on. Nifedipine IR should be avoided in Prinzmetal's angina. When adding a beta blocker to the treatment for Prinzmetal's angina, what type of calcium channel blocker should we use? Call and respond, class, dihydropyridine CCB. Instructor, exactly. Dihydropyridine calcium channel blockers are the ones to use in this scenario. Now, let's talk about ranolazine. How does it have a unique mechanism of action? Call and respond, class, it does not decrease heart rate or blood pressure. Instructor, correct. Ranolazine has a unique mechanism of action in that it does not decrease heart rate or blood pressure. Moving on, which drug do we use for fast relief and for chronic nitrate symptoms? Call and respond. Class, nitroglycerin. Instructor, right. Nitroglycerin is used for fast relief and for chronic nitrate symptoms. Now, which enzyme does ranolazine have a drug interaction with? Call and respond. Class, CYP3A4. Instructor, precisely. Ranolazine has a drug interaction with CYP3A4. Let's move on to the classification of nitrates. Can anyone name the short-acting drugs belonging to this classification? Call and respond. Class, glyceryl trinitrate and amyl nitrite. Instructor, correct. Glyceryl trinitrate and amyl nitrite are short-acting nitrates. And what about the intermediate-acting drug in the nitrate classification? Call and respond. Class, isosorbide dinitrate, ISDN. Instructor, well done. Isosorbide dinitrate, ISDN, is indeed an intermediate-acting nitrate. Finally, which long-acting drug belongs to the classification of nitrates? Call and respond. Class, isosorbide mononitrate, ISMN. Instructor, excellent. Isosorbide mononitrate, ISMN, is a long-acting nitrate. Alright, that wraps up our lecture for today. You all did a fantastic job. Welcome, class. Today, we're going to delve into the fascinating world of anti-anginal drugs. But first, let's do a quick recall. Can anyone list the 4 kinds of drugs used for anti-anginal treatment? Students respond. Beta blockers, calcium channel blockers, nitrates, and ranolazine. That's right. Now, let's start with the basics. 1. Beta blockers. Beta blockers are a cornerstone in the treatment of stable ischemic heart disease, SIHD. Can anyone tell me what SIHD stands for? Students respond. Stable ischemic heart disease. Excellent. And what is the first-line treatment for SIHD? Students respond. Beta blockers. Exactly. Beta blockers help by reducing the workload of the heart and decreasing its oxygen demand. 2. Calcium channel blockers. Now, moving on to calcium channel blockers. These are preferred for certain types of angina, such as Prinzmetal's angina. Can anyone name a calcium channel blocker? Students respond. Amlodipine, diltiazem, verapamil, etc. Great job. But what should you avoid when taking calcium channel blockers for Prinzmetal's angina? Students respond. Nifedipine IR. Correct. Nifedipine IR can worsen symptoms in Prinzmetal's angina. 3. Nitrates. Nitrates are another class of drugs used to treat angina. Who can tell me what nitrates are used for? Students respond. They're used for fast relief and for chronic nitrate symptoms. Absolutely right. Nitrates help dilate blood vessels, improving blood flow to the heart. 4. Ranolazine. Lastly, we have ranolazine. What makes ranolazine unique in its mechanism of action? Students respond. It does not decrease heart rate or blood pressure. Spot on. Ranolazine works by blocking the early INA channels, which helps maintain normal heart rhythms without lowering heart rate or blood pressure. Now, let's move on to the duration of action for different types of nitrates. Can anyone tell me the duration of action for short-acting nitrates? Students respond. 1 to 30 minutes. Excellent. And how about the duration of action for long-acting nitrates? Students respond. 8 to 12 hours. Perfect. It's important to understand the duration of action when prescribing these medications. Let's wrap up by briefly discussing some specific drugs. Who can name a calcium channel blocker used to treat angina? Students respond. Amlodipine, diltiazem, etc. Well done. And can anyone provide a generic name for amlodipine? Students respond. Norvasc. Great job, everyone. Today, we covered the basics of anti-anginal drugs, their mechanisms of action, and some important drug names to remember. Keep up the good work, and see you next time. 1. List the 4 kinds of drugs used for anti-anginal treat. Beta blockers meant calcium channel blockers, nitrates, ranolazine. 2. What is the first line for SIHD? Beta blockers. 3. What is the preferred drug for princemetals angina? Calcium channel blockers. 4. What do you avoid when taking calcium channel blockers for princemetals angina? Avoid nifedipine IR. 5. What do you use if adding a beta blocker to the treatment for princemetals angina? Use dihydropyridine CCV6. How does ranolazine have a unique mechanism of it dose not decrease action? Heart rate or blood pressure. 7. Which drug do you use for fast relief and for chronic nitrate symptoms? 8. Which enzyme does ranolazine have a drug interact CYP3A portion with? 9. Which short-acting drugs belong to the classification of nitrates? Glyceryl trinitrate, GTN, amyl nitrite, inhalant. 10. Which intermediate-acting drug belongs to the CLAS isosorbide denasification of nitrates? Trait, ISBN, 11. Which long-acting drug belongs to the classification isosorbide mono of nitrates? Nitrate, ISMN, 12. Which longest-acting drug belongs to the classifica pentaerythritoltion of nitrates? Tetranitrate. Anti-anginal drugs. 13. What is the duration of action for short-acting NI1 to 30 minutes traits? 14. What is the duration of action for intermediate-acting 2 to 3 hours nitrates? 15. What is the duration of action for long-acting nitrates? 6 to 10 hours. 16. What is the duration of action for longest-acting NI8 to 12 hours traits? 17. Which calcium channel blocking drugs belong to the amlodipine drug class of dihydropyridines? Felodipine, isradipine, nicardipine, nifedipine, nisolpine. Which calcium channel blocking drugs belong to the diltiazem drug class of miscellaneous? Varipil. 19. MOA of ranolazine blocks the early INA that facilitates calcium entry via the sodium-calcium exchanger. 20. Generic name for amyl nitrite. 21. Generic name for isosorbide mononitrate, oral isodyl sustained release, sublingual. 22. Generic name for isosorbide mononitrate, ISMO. 23. Generic name for nitroglycerin, sublingual, buc-nitroglycerin cal, oral sustained release, parenteral, transdermal path C, topical ointment, anti-anginal drugs. / 24. List all of the calcium channel blockers used to treat amlodipine angina. Clevidipine, diltiazem, felodipine, isradipine, nicardipine, nifedipine, nisoldipine, verapamil. 25. Generic name for amlodipine, Norvasc, Ambaz. 26. Brand name for Norvasc, Ambaz amlodipine. 27. Brand name for Cleviprex, clevidipine. 28. Generic name for clevidipine, Cleviprex. 29. Generic name for diltiazem, oral sustained recardizem lease, parenteral. 30. Brand name for cardizem, diltiazem, oral sustained release, parenteral. 31. Brand name for Plendil, felodipine. 32. Generic name for felodipine, Plendil. 33. Brand name for Dinocerc, isradipine, oral controlled release. 34. Generic name for isradipine, oral controlled release, Dinocerc. 35. Generic name for nicardipine, Cardine. 36. Brand name for Cardine, nicardipine. 37. Anti-anginal drugs. Generic name for nifedipine, oral extended Adalat, Procardia, lease, others. 38. Brand name for Adalat, Procardia, others. Nifedipine. 39. Brand name for Sular, nisoldipine. 40. Generic name for nisoldipine, Sular. 41. Generic name for verapamil, oral sustained Recalin, isoptin lease, parenteral. 42. Brand name for Calin, isoptin, verapamil. 43. List all of the beta blockers: acebutol, atenolol, betaxolol, oral ophthalmic, bisoprolol cartiolol, oral ophthalmic, carvedilol esmolol labetalol levobunolol metopranolol metoprolol nadolol nebivolol penbutolol pindolol propranolol sodalol timolol, oral ophthalmic, 44. Generic name for acebutol sectral 45. Brand name for sectral acebutol anti-anginal drugs 46. Generic name for atenolol 47. Brand name for tenormin 48. Generic name for betaxolol, oral ophthalmic, 49. Brand name for Bitoptic 50. Generic name for bisoprolol 51. Brand name for Zebita 52. Generic name for cartiolol, oral ophthalmic, 53. Brand name for Cartrol, Ocupress 54. Generic name for carvedilol 55. Brand name for Corake 56. Generic name for Esmolol 57. Brand name for Brevibloc 58. Generic name for Labetalol 59. Brand name for Normidine, Trandate 60. Generic name for levobunolol 61. Brand name for Betagon liquifilm, others 62. Generic name for metopranolol 63. Brand name for optipranolol 64. Generic name for metoprolol 65. Brand name for Lopressor, toprol tenormin atenolol bitoptic betaxolol zebita bisoprolol cartrol, ocupress cardarolol corake carvedilol brevibloc esmolol normidine, Trandate labetalol betagon liquifilm, others levobunolol optipranolol metopranolol lopressor, toprol metoprolol anti-anginal drug 66. Generic name for nadolol 67. Brand name for Corgard 68. Generic name for nebivolol 69. Brand name for Vistalich 70. Generic name for penbutolol 71. Brand name for Levital 72. Generic name for Pindolol 73. Brand name for Viscon 74. Generic name for Propranolol 75. Brand name for Inderol 76. Generic name for Sodalol 77. Brand name for Betapase 78. Generic name for Timolol, oral ophthalmic, 79. Brand name for Blocadrin, timopticating. List drug used for erectile dysfunction 81. Brand name for Avanafil 82. Brand name for Sildenafil 83. Brand name for Tadalafil 84. Brand name for Vardenafil Corgard Nadolol Vistalich Nebivolol Levital Penbutolol Viscon Pindolol Inderol Propranolol Betapase Sodalol Blocadrin, Timoptic Timolol Avanafil Sildenafil Tadalafil Vardenafil Stendra Viagra, Revachiochilus. At circa Levitra anti-anginal drugs. Last note, the views of this podcast represent those of my guest, S, and I note, purpose of these episodes not at all, for advice or medical suggestions. These are aimed to provide support for peer pharmacists in training in educational and intellectually stimulating ways. Again, these are not at all for medical advice, or for medical suggestions. Please see your local state and board certified physician, PA or NP, and pharmacist for medical advice and suggestions.
In the heart of the cell where secrets dwell, lies the nucleus, a masterful genesis, chromatin networks dancing in twists and swirls, holding the codes, the stories untold. O nucleus in your chromosomal embrace, regulating life with elegance and grace. Gene expression, in your controlled procession, you weave the fabric of our very essence. With histones and nucleosomes, a tightly wound script, epigenetic mysteries in a chromatic crypt. Transcription factors binding, with a rhythmic swing, promoters and enhancers make the cellular world sing. O nucleus, a dynamic domain so crucial, in cancer's shadow your balance becomes crucial. Gene silencing and activation in a delicate dance, in the story of life you lead the advance. Splicing and dicing RNA information, mRNA travels with vital information. From the depths of the nucleus to the cytoplasmic seas, a journey of codes unlocking life's mysteries. In the nucleus where genetic fates intertwine, mutations whisper, the onset of a malignant sign. Oncogenes and suppressors in a delicate play, when the balance tips the cellular order sways. O nucleus, in your realm so profound, life and death in your cycles are bound. In the dance of genes, Under the bossa nova sky, you hold the key where the answers lie. In the swing of life, in the rhythm of existence, the nucleus endures with resilient persistence. In the bossa nova beat, hear the cellular song, in the heart of the cell where the truths belong.
You are very important, especially to us here at the New Chemist podcasting group. You listening in is significant.
Vous êtes très important, surtout pour nous ici au New Chemist Podcasting Group. Votre écoute est significative.
Usted es muy importante, especialmente para nosotros aquí en The New Chemist Podcasting Group. Usted escuchando, es significativo.
Você é muito importante. Especialmente para nós do The New Chemist Podcasting Group. Você ouvindo, é significativo.
Είστε πολύ σημαντικοί, ειδικά για εμάς εδώ στο The New Chemist Podcasting Group. Το να ακούς είναι σημαντικό.
Sie sind sehr wichtig, besonders für uns hier bei The New Chemist Podcasting Group. Es ist wichtig, dass du zuhörst.
Je bent erg belangrijk, vooral voor ons hier bij The New Chemist Podcasting Group. Dat je meeluistert, is veelbetekenend.
You are very important, especially to us here at the New Chemist Podcasting Group. You listening in is significant.
Purpose of these episodes not at all for advice or medical suggestions. These are aimed to provide support to peer pharmacists in training in educational and intellectually stimulating ways. Again, these are not at all for medical advice or medical suggestions. Please see your local board and state-certified health professional. The views of this podcast represent those of my guests and I.
Thanks for listening to the podcast series The New Student Pharmacist, where we discuss chemistry and pharmacy, as well as leaders in pharmacy careers, community, and chemistry and pharmacy research. We encourage you to support the work we are doing and follow us on Spotify and Apple Podcasts by subscribing for free. We are so glad that you were able to tune in today. Note: the views on the podcast represent those of my guest, and I take care and all the best.